I'm Jack Johnson. I am the Executive Director and co-founder of the Fabry Support and Information Group, an organization that we started in 1996. So we've been involved in Fabry for some time. Fabry, as you may know, is a rare lysosomal storage disease with cell damage and buildup throughout the entire body for the most part. So it affects organ systems and a great variety of symptoms for men and women. The disease is progressive. There fortunately is treatment, but there are still a great deal of unmet need. Symptoms that give an individual a great deal of problems oftentimes are in the area of patient-reported outcomes or things that are difficult to measure. And, a big problem can be pain with Fabry disease, which has been talked about before, but also fatigue can be a serious impediment for individuals, and the temperatures can really be a big problem for Fabry. So for people that don't sweat or sweat very little, being able to do things outdoors can be very difficult and hard to accomplish or for other people to understand. Also, the GI symptoms, those can be extremely disruptive in a person's life, having to basically live around where the nearest bathroom may be. So that's another area. And again, there's great variation. So what one person experiences with Fabry is oftentimes different from others, even with the same mutation at times. So living in rural areas where you do have, especially areas with higher humidities, you can have extreme cold in the winter, extremely hot in the summer, and dealing with the humidity and mugginess out there becomes very difficult. So you have to work your life around being indoors in air conditioning. It can be very difficult to, go to your child's softball or baseball game that they're holding outside in a park somewhere or something like that. Also in the winter time, being able to keep your hands from freezing, your hands and feet from freezing and hurting. You can have Raynaud's type symptoms with Fabry where going outside and your fingers just start turning white. That can be very painful and difficult to deal with in the summer. And these temperature extremes can end up triggering various pain crises. So that's another point that people have to learn to cope with and tricks, wetting down, all these different kinds of things to deal with the summer heat and piling on the clothes in the winter. So unfortunately, the medical community is not very well trained to deal with a patient that gets hot easy or overheats or has problems with hands and feet freezing up in the winter and your fingers turning white. We have had medical professionals reach out about giving patients a script actually to get a cooling vest and hoping that insurance may help cover the cost of some of that for a cooling vest for someone to wear in the heat in the summertime. And we have a cooling vest program that we help distribute these to individuals in need to cope with these various conditions. But unfortunately, most of the medical community they don't have a way to help people cope with those conditions. With Fabry disease, many of the symptoms that an individual goes through are very difficult to measure. So as a result, doctors end up concentrating on the things that they can do with imaging or with tests of urine or blood, these types of things. And for many individuals, going in and having all these tests all the time on an annual or semi-annual basis may not seem that important because they may not be in serious problems on one of these organ tests that the medical community likes, but it may become important down the road. So monitoring those is still very much needed to accomplish. even though it may not impact your daily life in any way that you notice. So, that's one of the frustrations that some patients deal with is the doctors care about easy things to measure, blood tests and so forth, but the patients care about, how they feel on a day-to-day basis. That's where patients live. They don't live in test results until organ damage becomes very significant and kidney or heart or breathing in instances becomes more compromised. Then it can have a bigger impact on day-to-day life. The way the medical community can keep track of some of the patient-reported outcomes are doing the quality of life surveys, the pain index surveys. There are GI surveys that you can take, but doing all those surveys all the time and not getting any relief is a very frustrating situation in many instances for patients. So for my personal situation, if I am late getting an infusion or early because I may have to change my schedule due to travel or something, I don't really feel that much of a difference. But other patients, many of them do. And they will have, 2, 3, 4 days sometimes before they receive an infusion that they start experiencing those symptoms will coming back being more significant, and then they'll have their infusion, and then the symptoms afterward will kind of level back out again. And so they go through these biweekly cycles of feeling well and not feeling well. And that's a difficult thing for a lot of patients to deal with. Again, an area of unmet need in the patient community, and hopefully there will be better ways to cope with that, to manage those symptoms before long. Once every 2 week infusions can be quite burdensome for many out there, and having infusion reactions is something that a fair number of people have to deal with. As a result, their infusions take longer and they may have pre-medications and so forth they have to take before, which can have their own side effects. But yeah, so there are some people, you can't necessarily miss a day of work every 2 weeks for the entire year, or impacts your ability to go to school, whether you're in grade school or whether you're in college. One of the things that we do see happen is people will start treatment and not feel that much different, because treatment does take time to make a difference for an individual. It could take 6 months to a year before someone may start feeling a difference. And people kind of give up at times when they don't notice a difference, and so they will discontinue treatment. We see that with certain people, also younger people in the 18 to 30 range or early 30s. People want to get on with their lives. They were on ERT when they were kids in high school, and now they're in college, or they're trying to start a family, they're starting new jobs. They have all these different pulls on their time and energy, and they may discontinue. We hope that if that is done, that they don't have significant organ damage during the time period. But lots of times they don't come back to treatment until they have a reason to. And unfortunately, that may be a change in the test result or how they feel or these types of things. Then they get back on treatment when they get older. Sometimes that results in damage that cannot be reversed with disease progression. For patients that are looking for other options or so forth, there are clinical trials available that some are starting up, some were just what they've completed and we're just waiting to get the data results on them. We hope that the FDA will see significant evidence to support approval of these different therapies that are being developed, next generation therapies. And, one of the things the community really wants is to not have this burdensome treatment process. So if they could get a once a month infusion, so reduce the number of infusions per year, if they can get gene therapy, hopefully a one and done approach, or if it's just a treatment that you have to go through once every 10 years or something like that. Those would be great advancements in the eyes of the community. So we're hopeful, and we're watching the test results, or the published papers and so forth that come from these clinical trials, and hope that there will be other options for the community in the future. Our community likes us following World, but they also want the option to have meetings in other locations. So what we do is we'll have a meeting following World, then we'll go somewhere else and have it a different time of year, oftentimes in April. Our last meeting that we had was in Atlanta, Georgia, towards the end of March. So this coming year, we're not going to go back to World. We're going to do another meeting away from World, and it's going to be our 30th anniversary for the organization. We're looking to hold the meeting in April. We haven't decided on the final decision on the location yet,